Let's ask the doctor, Dr. Marc Siegel. Doctor, if you have mild symptoms, should he be working today?
Well, Brian, it wouldn't be what I would suggest to my patients, and it's not what I suggest. And I want to make a point here that I don't think we focused enough on, which is, yes, he's got mild symptoms. And yes, he's got upper respiratory congestion and cough, which is very common. And yes, I do think that the vaccine, 4 shots, played a role in the decreased symptoms. And I think Omicron itself is much milder and is generally upper respiratory, which is a big positive for the United States. And yes, I think the drug Paxlovid is very, very helpful in this situation, and I prescribe it a lot, and it decreases the risk of severity and hospitalization a lot. But you know what isn't being focused on, Brian? Right. The concern about fatigue and possibility of brain fog. Now, I see a lot of that in my patients, and it may be very minor, but you're talking about the President of the United States here, right? So if he has any confusion whatsoever, even the fatigue as a symptom, is something that I think his physician should be keeping a careful eye on, and might be a reason that he shouldn't be working. And by the way, where is his physician, Dr. Kevin O'Connor? Dr. Ashish Jha, who I know well, is an epidemiologist.
He should never have been. He should have been out there yesterday.
Hey,
Dr. Connor should have been out there.
Dr. Siegel, what about him not taking Eliquis, the blood thinner, because he has had the brain aneurysms in the past?
Yeah, you know, Ainsley, that's a really good point, and I was surprised at that because a lot of doctors, a lot of cardiologists would have cut the dose, would have adjusted it. He has atrial fibrillation, which is an irregular heart rhythm. It puts him at risk for heart events or stroke, but holding it for 5 to 8 days is a very, very minor risk, but I was surprised at that, too. I would have, in most cases, you would try to continue it at least at a lower dose most of the time.
Well, he's got some of the best doctors in the world, and one of our great doctors offering advice as well. Marc Siegel, thank you very much.
I expect him to do well, but they have to keep a careful eye on him for the next week at least. And no, by the way, he should not be going out without a mask, and photographers wearing masks is not enough. And 6 feet, by the way, Steve, last point, has been shown not to work against these variants. They need a consistent public health message, right?
I know.
Dr. Siegel, when do we move on? When do we just say we're going to have to live with this and not worry about masks and not worry about the distancing? Is that a possibility?
Ainsley, I think they're telling us that. Ainsley, I think that's what they're actually doing. You see them, they're out and about. Jill Biden's not even wearing the right mask. I mean, you don't see Kamala Harris isolating herself. They're telling us unwittingly that that's what they're doing. They're moving on.
Tell that to San Diego. They're shutting down their schools.
Thank you,
Dr. Siegel. Thanks so much.